Atrial fibrillation, or as we call it an AFib, is an irregular and often a very rapid heart rhythm that can lead to blood clots in the heart. Now, AFib, it increases the risk of stroke, heart failure, and various other heart-related complications. Ablation of persistent atrial fibrillation still remains a challenge. Now, if I talk about ablation, it is a procedure used to treat atrial fibrillation. It uses small burns or freezes to cause some scarring on the inside of the heart to help break up the electrical signals that usually cause the irregular heartbeats. Left atrial fibrosis plays an important role in the pathophysiology of atrial fibrillation and has been associated with poor procedural outcomes. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about the effect of MRI-guided fibrosis ablation versus the conventional catheter ablation on atrial arrhythmia recurrence in patients with persistent atrial fibrillation. To investigate the efficacy and adverse events of targeting atrial fibrosis detected on an MRI scan in reducing the atrial arrhythmia recurrence in patients with atrial fibrillation, few US-based researchers conducted what we call the DECAAF-2 randomized clinical trial. Now, the efficacy of delayed enhancement MRI-guided fibrosis ablation versus the conventional catheter ablation of atrial fibrillation trial was an investigator-initiated multi-center randomized clinical trial involving close to a total of 843 patients with symptomatic or asymptomatic persistent atrial fibrillation condition and also undergoing atrial fibrillation ablation. The primary endpoint was time to first atrial arrhythmia recurrence after a 90-day blanking period post the ablation procedure. The primary safety composite outcome was defined by the occurrence of one or more of the following events within the 30-day post-ablation that included stroke, PV stenosis, bleeding, heart failure, or even death. The results of the study showed that there was no significant difference in the atrial arrhythmia recurrence between the two groups. Patients in the fibrosis-guided ablation plus the PVI group experienced a higher rate of safety outcomes. 6 patients, constituting approximately of 1.5% in the fibrosis-guided ablation group plus the PVI group, had an ischemic stroke compared with none in the PVI alone group. 2 deaths also occurred in the fibrosis-guided ablation plus the PVI group, but the first one was possibly related to the procedure. Therefore, based on the results, based on the findings, the researchers concluded that among patients with persistent atrial fibrillation, MRI-guided fibrosis ablation plus the PVI compared with PVI catheter ablation alone resulted in no significant difference in atrial arrhythmia recurrence, meaning that these findings do not support the use of an MRI-guided fibrosis ablation for the treatment of persistent atrial fibrillation. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.